Hello everybody, welcome back. I want to talk to you today about liposuction 360. Although the term is newish and has been used a lot on social media lately, 360 liposuction has been performed at Visage for 23 years. I've quickly learned, despite my training of trying to do liposuction between the patient and the operating table, that it was not the right way to do. There's no way we can achieve excellence by doing it blindly under the patient. So over the years with my nursing team, with my anesthesiologist, we've kind of managed to do an expert rotation of flipping of our patient in a very safe manner so that I can achieve the results I've always aimed for with, for our ladies, a beautiful hourglass shape, and for the male, this nice triangular, so masculine shape. So we flip patient all the time. We call it 360 liposuction. For our ladies, it's usually lower back, accentuated in the mid back, and I also do the upper back. Most of our ladies have this fat above the bra roll, above the bra strap, which I like to address at the same time. Whereas for our males, it's more commonly the lower back. Now the perks of doing liposuction to the back is not only to remove this extra fat, it's also to contour the buttock. Buttocks, even though we don't augment them all the time, it's nice when they're well defined for both male and female. So I like to remove that layer of fat in the rolls to get a better look and a better definition in the buttock region. Now liposuction is done alone as a simple single procedure, but can also be done with etching, abdominal etching, for example. We can do other muscle etching that's done commonly. I do lipo 360 with our tummy tucks. We do liposuction 360 with other liposuction underbodies, such as what we do with lipedema, for example. So liposuction is a very common procedure, and I tend to talk about liposuction like salt and pepper in cooking. Liposuction helps all our results to look better. So if I do a breast lift, there's a bit of liposuction to the bra roll. If I do a face lift, neck lift, there's liposuction to the neck. I do an arm lift, I do leg lift, there's liposuction. Liposuction helps to make our results look better. So liposuction is important. Now, just a few hours ago today, a patient of mine asked me, how do we make sure that there is no divot or cannula track or imperfection in the skin with liposuction? Because literally with a long cannula hollow tube, we're suctioning tunnels of fat in the body. And this is a very important question, and I want to dedicate a few minutes to this answer. Now, it is kind of incredible that we get almost always very good results with liposuction despite doing this, what I call Swiss cheese suction of fat in the body. So the way plastic surgeon, and for sure in my practice, the way we try to minimize those problems with surface imperfection, with little lumps and bumps or cannula track, is to attack an area of the body via 2 or 3 axes. So instead of going always with the same kind of motion from one incision, I like to attack an area by 2 angles or 3 sometimes in order to divide a little bit the access to the area to get a better, smoother contour. There are parts of the body where we have 2 layers of fat, and those are the common areas for liposuction. So the abdomen, the flanks, lower back. We have the inner thigh, inner knee, outer saddlebag area. Those are a little bit safer for skin surface, so we go in the deeper layers, and we tend to get almost always a very smooth result. Now today, we stretch the limits a little bit. We go into zones where in the past were forbidden for liposuction, such as the lower legs, for example, such as the anterior part of the thigh, such as the iliac rolls below the love handles. Those are areas where we have 1 layer of fat, where it's a little bit more predisposed to getting unevenness in the skin. So when I get to those areas, and again, I do lots of lipedema surgery in Toronto where ladies have long tubular legs, we have to do the lower legs. So I take more time to do it. I do it carefully. I do it with a small cannula. Smaller cannula lesser problems. So it's another way to minimize those problems. And I strongly believe in a newer concept called equalization. When we do safe liposuction, safe refers to the safety of the procedure, but also it's an acronym, S.A.F.E. E stands for equalization. So when we're done with the liposuction, I stop the suction, I use a tip that's a little bit wider, and I continue for another 5, 10, sometimes 15 minutes, and I do some back and from liposuction maneuvers without suctioning. That has the effect of breaking a few additional fat cells, and we allow the fat cells to kind of float in areas where maybe we created a little depression or a little track. This is called equalization. It's been advertised and educated for the last 10 years now in the US and now in Canada, and it's something I do on every single patient, and more so in those areas where we used to do no liposuction. I also believe in the equalization in the post-op course, where we do lymphatic drainage, lymphatic massage, and deep body massages, which also helps to manipulate the soft tissue in order to get a very nice, even contour and skin surface. So liposuction is obviously by far the most common procedure that plastic surgeons do, and in part because it's part of many of our procedures. It is not necessarily the safest procedure, so if you read online, you'll see that the complication rates with liposuction is quite high, and it's in big part because in many parts of the world, including the United States, any kind of doctor is allowed to do liposuction. Now, in Ontario, Canada, only plastic surgeons are allowed to do liposuction. We're trained for 5 years. It's not a Cancun weekend trip where you learn the basic of liposuction. It's a 5-year residency dedicated to plastic surgery. Liposuction is a strong component of this. We learn to manipulate the cannula. We learn how to feel where the cannula is. I always like to tell our patient, cannula is a strong, flat, long arrow that can go in the places we don't want it to go. So it's important that you find a provider that's not only a good technician, but also an artist who knows what liposuction is, knows the pros and cons, knows the limitation, and knows also his or her own capabilities in delivering optimal results in a safe environment. So this is Liposuction 360, something I do proudly at Visage Clinic many times every week for 23 years. Thank you for watching. If you have any comments, please feel free to ask your questions and we'll answer to you. Thank you. Have a lovely day.